Welcome to this video, which is going to give you information on how to deal with a newly diagnosed case of rectal cancer or cancer of the rectum. I'm Dr. Vinay Samuel Gaikwad. I'm Director of Surgical Oncology at CareAssist Hospital in Gurgaon, and I specialize in gastrointestinal cancer treatments. So this video hopes to make you understand how to not panic after being diagnosed with rectal cancer, how to proceed and give you a rough idea of what's in store in terms of the treatment and the outcomes of a person diagnosed with cancer of the rectum. Now, if you're diagnosed with rectal cancer, it's probably after a colonoscopy because you've had blood in the stool, or altered bowel habits, or maybe you're losing weight for some time and losing appetite. Whatever the reason is, you've probably been diagnosed after showing your surgeon or physician, and a biopsy has been taken, which has come out to be cancer, which the most common cancer of the rectum is adenocarcinoma. And now the dilemma starts. What is to be done next? So there's a lot of emotional issues related to this, but this video will be dealing with the clinical issues of how to proceed once it's been diagnosed. So the first thing that we would want to do are the blood tests and imaging. By imaging, I mean scanning. So usually in rectal cancer, we usually get a CT scan of the chest and abdomen, or a PET scan, which is a special scan for cancer, which is a whole body scan, which there's a special medicine that's injected that lights up wherever there's cancer in the body. So that helps to identify whether the cancer is localized to the rectum or if it's spread to other parts of the body. In addition, most surgeons will also get an MRI of the pelvis or the lower part of your abdomen to exactly stage the cancer in the rectum. Now, once the imaging has been done, we'll have a fair idea of the stage of the disease. So unless it is a very, very early stage, which is very unlikely, that is stage 1, if it is not stage 1, then what we usually tend to suggest is not surgery directly, but we suggest what's called chemoradiation. That involves mainly radiation therapy for roughly 5 weeks, 5 days a week for 5 weeks, along with either a tablet or injection, which is chemotherapy, which helps the effect of the radiation to be better than without the chemotherapy. So this treatment is usually well tolerated with minimal side effects. The radiation therapy doesn't require admission, but it just requires you to visit the hospital for that period of time. So after the radiation is complete, usually the symptoms which were experienced before will subside either partially or entirely, and after the radiation is completed, we wait for 6 to 8 weeks in which there is no treatment being given to the patient. After the 8 weeks is completed, we do a re-evaluation with the MRI and the scan both, and the CEA report, which is a tumor marker, and once that is done to assess the amount of response. And it's even more important when we have low-lying rectal tumors, that means tumors very near the anal opening or the anal verge, because we always try our best to save the anal passage. That means that after the operation, we intend for the stool to be passed through the natural anal passage. For that to be done, we need a little bit of distance from the sphincter or the controlling mechanism, which helps us to control when we pass both flatus as well as stool. So if the distance from the anal verge on your colonoscopy or whatever examination has been done is even 2 centimeters, let's say, there's still a fair chance that the passage can be preserved with a surgery. called intrasphincteric resection or ultra low anterior resection. This can be done with minimally invasive techniques such as laparoscopy or robotic surgery. So that is what will be offered after radiation is complete, a surgery to completely remove the tumor. This is very important to undergo so that the tumor is removed completely from your body, because many times we might feel that the tumor has been shrunk or tackled with radiation, but we can never be sure unless we remove the disease completely by a surgical procedure. Many times if it's low, that means if the tumor is maybe less than 10 centimeters from the anal verge, there will be a temporary stoma or ileostomy bag which is attached to your abdomen, through which the stool will be coming out for a period of time. So this period of time will depend on whether you require chemotherapy after the surgery or not. Most patients do require chemotherapy for 6 months. So generally the bag remains for 6 months after the surgery, and once the chemotherapy is completed, then a small operation is done to close the bag, and the stool starts coming out through the normal passage as before. Sometimes if the cancer is right at the verge or the anal opening, or is involving the sphincter, then the passage cannot be preserved, and there will be a permanent colostomy made, a stoma bag made, and that will be there for the entire lifetime. But there are many scientific studies that show that this still gives you a better quality of life than any other type of procedure that can be done. That is a permanent colostomy, and you can live a normal life even with the colostomy bag. So that is a rough idea of how things play out, and the chances of cure are still high, especially if it's localized. And even in rectal cancer, if there's metastasis or spread to the liver or lung or even peritoneum, there are many treatment options, including surgical options, to ensure that all efforts are made to cure you completely of the disease. So thank you for your attention, and I hope this has helped you to understand briefly, in short, how things lie ahead, and you can share it to anybody you feel will benefit from this video. Thank you for your attention.